Hello, my name is Ravisha Kumari Patel, Ravisha Kumari, last name Patel, Patel. I'm going to do 360 of the room. And I have the phone on the tripod here. Hello, my name is Ravisha Kumari Patel. I'm going to be your nurse for the day. I noticed your blood pressure is 167 over 100 and the heart rate is 105. The reason behind this blood pressure and the heart rate is abnormal is because the hypertension shows the artery is pushing against the wall. That's why the blood pressure is higher, and the heart rate could be due to the pain and anxiety. I'm suspecting also an MI. I'm going to do the 12 ECG to monitor the rhythm and the rate and look for any dysrhythmias, as well as I'm gonna monitor the vital signs more frequently and notify the healthcare provider. I'm gonna do the cardiac inspection. Looking at the patient, looks uncomfortable, unwell, no edema, no diaphoresis noted. Patient is behaving normally, however, slight increased work of breathing while he's talking and walking. No jugular vein extension noted, as well as the color is pink, no sinus is noted, and no obvious pulsations noted, such as aortic. I'm now going to do the inspection of the GI abdomen. Looking at the abdomen, the color is pink, no jaundice noted. Looking at the umbilical is in a midline, so the abdomen is symmetric. Contour is flat. There is no skin conditions such as rashes, lumps, lesions, striae noted. I'm gonna do the cardiac auscultation, listening for the S1, S2 sounds. I'm gonna landmark 5 areas, listening with the diaphragm. 1, 2. Right side aortic area, second intercostal space, going across. Second intercostal space, left side, left sternum border, pulmonic area. Third intercostal space on the left side, left sternum border, Erb's point. And the fifth intercostal space, tricuspid area, left side, left sternum border. Just going across here to listen for the mitral area. Fifth intercostal space, mid-clavicular line, left side, mitral area. Now I'm going to repeat the same thing with the bell to listen for any S3, S4 sound. Okay, second intercostal space. Also listening for any murmur, which is the blowing, whooshing sound. I hear the S1 sound loudest at the apex and the S2 is loudest at the base. Now I'm going to listen the apical pulse for a minute. Okay, the apical pulse rate is 105, the rhythm is regular. Now I'm going to do the auscultation of the abdomen. Please lay down. Right lower quadrant where the appendix is. Right upper quadrant where liver is. Left upper quadrant where spleen is. Left lower quadrant where descending colon is, and I did the clockwise manner. Patient doesn't show any sign of pain at this moment. Now I'm going to do the percussion of the abdomen. I'm going to do the clockwise, watching the patient's face for any pain or grimaces. I'm going to be doing the 3-finger method and tap 3 times. I hear on the lower quadrants, I hear the tympanic sound due to the air in the intestine, and the dullness over the upper quadrants because of the large organs. Now I'm going to palpate the arteries, carotid artery one at a time for about 3 seconds. Brachial arteries, bilateral simultaneously, and the radial arteries bilateral simultaneously, as well as dorsalis pedis pulses. And I'm going to do the hand hygiene. The rate is 105 regular. The rhythm is regular, as well as the strength is normal 2 plus, and they are equal. Now I'm going to do the capillary fill for about 3 seconds. It is less than 3 seconds. It is normal. Okay, and I'm going to do the hand hygiene again. Now I'm going to do the palpation of the abdomen to look for any masses, or if there's any organ enlargement. I'm going to do the circular motion, watches the patient face for any grimaces, pain. I'm going to do the, I'm going to start with the furthest from the pain. So it is 3-finger circular motion, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No organ enlargement or masses noted. For the nursing intervention, I think what's going on for this patient is experiencing ACS or MI given the vital signs in an abnormal range. Nursing intervention I would like to do is to validate ECG on this patient to monitor for any dysrhythmias, as well as cardiac blood work to look for any myocardial damage. The physician orders, I would expect them to write a tele monitoring order, to watch for the continuous tally order for looking for dysrhythmias, as well as give patients some nitro to relieve chest pain, as well as aspirin to relieve platelet aggregation. Thank you.